Thank you all for joining us to talk about the financial impact of a breast cancer diagnosis. As many in our community know, it can be an unexpected side effect of treatment that can impact your life and your family's life for years after a diagnosis. Breastcancer.org's mission is to give people trusted information, actionable guidance, and the confidence to make medical decisions. When we began our research on the cost of care 6 months ago, that's exactly what we set out to do with our reporting on this issue. We believe everyone deserves the best care possible without having to drain their savings or worry about paying their bills for essentials like housing, food, and medicine. Our new special report on the cost of breast cancer care gives an in-depth look at the major causes of financial problems due to cancer care and the steps you can take to make those costs more manageable. The report includes eye-opening results from our survey study, which I'll share more about in a bit. First, I want to thank our generous sponsors for making this event possible: Hologic, Gilead, Lilly, Pfizer, and the Center for Restorative Breast Surgery. Thank you so much for your support of Breastcancer.org. Later in the program, we'll hear from Eric Anderson, Division President of Breast and Skeletal Health Solutions at Hologic. We're looking forward to learning about Hologic's work to help reduce screening costs for patients. We are honored to be joined by a phenomenal group of experts who are leading the way in helping to alleviate costs for people with cancer while ensuring that they can get access to the care that they need. They each contributed to the special report on the costs of breast cancer care, and we're grateful for their insights and the work they do each and every day advocating on behalf of patients. Fumiko Chino is a cancer researcher and radiation oncologist with a focus on breast and gynecologic cancers and a co-lead of the Affordable Working Group at Memorial Sloan Kettering Cancer Center. She's also one of the directors at the Costs of Care Group, an NGO focused on affordability in cancer and healthcare. Dr. Chino has been nationally recognized for her research, including with the inaugural 2022 ASCO Excellence in Equity Award. Stacy Doucette-Zena is an associate professor in the Department of Health Policy and an Ingram Associate Professor of Cancer Research at Vanderbilt University Medical Center. Her research focuses on costs of medicines and patient access to care. Dr. Doucette-Zena is frequently called upon as a subject matter expert by national media outlets and government agencies. Molly McDonald is a 17-year breast cancer survivor, writer, patient advocate, and the founder of the Pink Fund, which provides 90-day non-medical financial aid to people with breast cancer. She founded the organization in 2006 after going through her own breast cancer diagnosis and experiencing firsthand the financial burdens patients face. The Pink Fund has made $6.4 million in bill payments for people in active treatment. Joanna Morales is a cancer rights attorney, author, speaker, and CEO of Triage Cancer, which provides free education on practical and legal issues that impact people with cancer and their caregivers. Among many accomplishments, Joanna co-authored the book Cancer Rights Law for the American Bar Association, the first and only book of its kind. She has presented over 1,000 educational seminars on cancer rights throughout the country. Amy Niles is the Chief Advocacy and Engagement Officer for the PAN Foundation, which stands for Patient Access Network. The PAN Foundation is a national nonprofit that provides financial assistance to people who are underinsured, and they advocate for improved access to affordable care. Amy is a longtime patient advocate and policy expert who drives legislative change to benefit and protect people with cancer. And our moderator today is Loriana Hernandez Aldama. Loriana is an award-winning journalist, author, two-time cancer survivor, patient advocate, and the founder of the nonprofit Armor Up for Life. We'll be hearing more about Loriana's personal story in a bit. I also recommend checking out a recent Breastcancer.org podcast episode featuring Loriana and Joanna discussing the cost of care. Thank you all for being here today. I wanted to share this powerful quote from Megan, a mom who was diagnosed with metastatic breast cancer at age 38. No one saves for cancer, and it's devastating to deal with financial problems on top of dealing with your diagnosis. No one saves for cancer. This statement really gets to the heart of the problem, because even if you have savings and a good job, the high out-of-pocket costs that some people have to pay and the possible work missed are hard for most of us to prepare for, especially people in need of ongoing treatment. The high cost of care affects people with every type of cancer, but people with breast cancer have higher out-of-pocket costs, even people with insurance. In 2019, the total out-of-pocket cost was overall for the US people with breast cancer was $3.14 billion. And there is a serious risk of worse health outcomes if people are skipping appointments, tests, or only taking part of their medication. The emotional and mental health toll is also significant because of the anxiety and possible shame people feel. We decided to focus on this issue as an organization for all the reasons I just mentioned. And while there are excellent data on the cost of care, we wanted to know specifically about how people with breast cancer, how you are being affected right now. We spoke with experts and led a patient focus group and survey study in June and July of 2022 to create our special report that includes steps you can take to make costs more manageable. You can read the full special report at breastcancer.org/cost of care report. It's cost-of-care-report. And we'll email you that link to you when the event today is over and with the event recording. Our survey study included more than 1,400 people in the US who were diagnosed with breast cancer in the past 10 years. So what did we find? Well, nearly half of the people with breast cancer had serious financial burdens described as significant or catastrophic. Many people had expenses during and after treatment that were higher than they expected and not covered by health insurance. We asked which strategies people used to cope with their expenses. Many had to make difficult choices to pay for their treatment, such as borrowing money, using up savings, or even taking less medicine than prescribed. 37% reduced spending on basic necessities like food and housing. It's important to know that almost anyone with breast cancer is at risk of facing financial struggles, but especially young people, those without insurance or a lower income, Black and Hispanic people, and people living with metastatic breast cancer, which requires ongoing treatment for the rest of their lives. The high cost of breast cancer are making existing health disparities even worse. And we'll talk more about that with our experts during the panel discussion in a few minutes. To better understand why people experience financial problems, we asked researchers, financial navigators, advocates, and people who've been diagnosed with breast cancer to tell us what they think is most common. First, many people with health insurance have out-of-pocket costs they can't afford because their plan doesn't provide adequate coverage for doctor's visits or medications. There may be high deductibles to pay each year, as well as monthly premiums. And many plans have a yearly out-of-pocket maximum that needs to be met first before their coverage kicks in. People who don't have insurance may be responsible for the full cost of their care, and in some cases, they're charged higher rates for treatment because they don't benefit from discounts given to health insurance companies that negotiate the pricing. Second, prescription drug costs can be out of reach for people with breast cancer. Newer brand name medicines that you can take by mouth at home, which aren't available as more affordable generics, tend to cost more. Some people who have health insurance with a higher deductible and out-of-pocket premium, out-of-pocket maximum limit, may have to pay thousands of dollars for medication each month, depending on the cancer medicine that's prescribed. The cost can add up for people taking medication for years to lower the risk of breast cancer recurrence. People who want or need to keep working after a breast cancer diagnosis often find it challenging to manage their job and maintain their income. And of course, their benefit may come from their job, and taking time off from work for treatments or to recover from surgery can lead to lost wages. Sorting out the details of how to work your treatment around your job and knowing what protections you're entitled to can be confusing. There are laws that protect some categories of workers who need to take leave, and we'll be getting into that more with our panelists. Lack of access to financial help and advice is a big issue, and navigating these challenges can feel overwhelming and lonely. But there really is help out there. Most cancer centers have financial navigators or social workers that you can talk to, and there are trustworthy nonprofits offering free guidance like our friends will be hearing from in a bit. The additional expenses can be really surprising, and they can pile on quickly during and after treatment for everything from treatment to supportive care, like someone to watch your children or necessities that you have. Let's look at some of the answers in the survey. Some expenses are for medications like we talked about a moment ago, but there are many expenses that are not covered by insurance, like the over-the-counter medications to manage side effects, gas to get to the appointments that may be far away, and special clothing like bras and then wigs and all kinds of things. For example, 26% of people said an unexpectedly high expense was post-surgery bras and other clothes related to their treatment. And let's get back to the issue of employment for a minute. 50% said breast cancer had a significant negative effect on their career. 64% said their job situation changed for a reason related to breast cancer. And 36% said that their caregivers also had to reduce their hours, take off time from work, or change jobs just to help us, those of us with breast cancer. The question is, what can we do to manage and reduce costs? I'm going to share some ideas, and we'll hear from our panelists with suggestions, and you can find more details in this special report on our website. Like, you can try to lower costs for medication by comparing prices at different pharmacies, looking for manufacturer coupons or discount cards, and talking with your healthcare team about your options. You can meet with a financial navigator at your cancer center to better understand costs for your situation with the insurance that you have. Find help getting insurance if you're uninsured, and learn about grants to apply for and have your questions answered. You can check at least once a year to see if there are other health insurance plans that are better fit for your current needs. Just be sure to confirm that your doctors will take the new insurance you're considering switching to, and that your medications will be covered. To manage work obligations during treatment, you can start by reading your employer's leave policies and getting information on employment rights from Triage Cancer or another expert before talking with your employer, so that you can go into that conversation knowing your rights and benefits. Medical bills often contain errors, and you can avoid overpaying if you check your bills for mistakes and charges that you don't understand or for things that you never received. Before you pay your bills, review the final explanation of benefits from your insurance company. You may want to hire a professional medical bill review service to catch errors and advocate on your behalf with billing departments. They do charge a fee, but it can save you time and money depending on your situation. You want to ask if the person you're hiring has credentials from the Patient Advocate Certification Board. Find out what financial assistance programs are available at your hospital. Again, you can ask the financial navigator or a social worker. Use your health insurance plan effectively by learning the rules for your plan. Call them and ask questions like, do I need to get prior authorization for any tests or treatments? What's the time limit for submitting claims? How much are my copays, coinsurance, yearly deductibles, and out-of-pocket maximums? You can try to negotiate your medical bills with your healthcare provider or hospital. Explain why you can't afford the bills and ask for payment options and reductions. And lastly, ask your doctor if it's possible to have some appointments virtually to cut down on travel costs, or ask if you can receive care closer to home. There are a lot of wonderful organizations offering assistance with medical and other breast cancer related expenses and support. They want to help you through these challenges, like Triage Cancer, the Pink Fund, the Pan Foundation, the Breast Cancer Assistance Fund, Cancer Care, and many others. You can find a long list of resources at breastcancer.org/charitable-resources. Now it's my pleasure to introduce Loriana Hernandez Aldama, who will be moderating our panel discussions. But first, I wanted to ask Loriana about her personal story and how she became a patient advocate. Welcome, Loriana.
Thank you so much for having me. What an introduction and all the work that you're doing. It's just an honor to be here today. For me, how I came to the breast cancer space by way of AML leukemia. And as you mentioned, I was a high profile news anchor living the life. And at the time I didn't have financial troubles. And you would think if you're getting an anchor salary, my husband's working in TV, and then you're diagnosed with AML leukemia and you're told you're going to stay in the hospital for an entire year, say goodbye to your son, hand him over to your mom in another state for a year, find childcare. So at that time, when I knew it was a year, not understanding what to do, I quit my job, and my HR didn't inform me of what to do as far as how to navigate that, even being well educated and going through that, then having to pay for someone to help my 80-year-old mother raise my 2-year-old son for a year, pay our house payment. We needed a GoFundMe, which we all know a GoFundMe is not a plan. That's why we're here talking about financial toxicity. But it really made me wonder, if we are struggling and we're about to lose our house and we can't pay our bills, and I'm even today, eight years out, I still have mounting medical bills into survivorship. I always wondered, how would anybody else get through this who isn't as well connected, isn't as health literate, doesn't have the transportation? And it really forced me into my advocacy to really go on assignment as that journalist. I lost my career, but never the passion to tell stories and help other patients, because for me, it's a constant struggle. And 5 years to the day after my leukemia treatment, I was diagnosed with breast cancer during 2020. And again, that presented more bills, more mounting bills. And I'll leave it at this. I remember calling after my husband lost his job and I'm not working, and saying, I need your financial assistance program. And the girl who answered the phone at a high level institution said, I'm the only person running the financial assistance program and I'm on vacation. I said, how can you have one person? So through those journeys, and for me, the depression and the anxiety of paying our bills and getting on our feet really made me, I've been talking about financial toxicity for a long time. And it's something we do now at my nonprofit, Armor Up for Life, is amplify the patient voice and do a lot of the great work that all of you are doing. Because if you're hourly, and you're an hourly worker, it's even more complicated. And you're talking about FMLA might not be an option. This year, my sister was diagnosed with breast cancer.
Oh my goodness.
And she is an hourly worker, was making $10 an hour as a pre-K teacher. And much of what you talked about in your introduction is what she's struggling with. She delayed her treatment because she couldn't afford to miss work. She didn't have a support system because she's working too much, that she didn't have time to have a network of friends like I did. So it snowballs, and this is so important. So I'm just honored to be here talking about this today. And I really hope that we can empower and enlighten everyone with the information we've all been working hard to gather and help other people.
Wow. It's amazing how your experience redirected the whole purpose of your life. And just to, share with people that the financial toxicity, the cost of care, can be like another disease on top of what you've already, so you had, leukemia and then breast cancer, and then you have this other illness that's making you dis-ease, lack of ease.
Yes.
The cost of care that lingers longer, and it makes many people feel embarrassed, shameful. It's like a bad secret that you have to, desperately scramble to fix. So, Loriana, I'm going to hand this over to you now, and thank you for leading our panel.
Thank you so much. Again, it's an honor. And I say that when I travel and speak now, I say that there's two new comorbidities, and that's psycho-oncology and financial toxicity. And those are comorbidities that impact our care. It's why we're having these discussions today. So thank you. So I do want to go ahead and start with our panel. It is my honor to introduce to you Dr. Fumiko Chino from Memorial Sloan Kettering Cancer Center in New York City, and Dr. Stacy Doucette-Zima from Vanderbilt University Medical Center in Nashville. Thank you both for joining us. I want to start with each of you explaining why you each decided to focus on financial toxicity research. We know how important it is. And tell us a little bit about your story. And I know for all of us, it's so personal. So I want to hear what brought you to this space.
I can start. I'm Dr. Chino from MSK in New York City, and I think my story honestly very much mirrors yours, which is that my life was spectacularly derailed by a cancer diagnosis. In my situation, it was actually my husband's, and his underinsurance and the high bills really fundamentally changed our lives. Unfortunately, after he died of cancer, the medical debt from his treatment really followed me for a long period of time. And it really set me on the path to go to medical school. This is a total career change for me, and to do the research that I do in financial toxicity and affordability. So I really do have skin in the game similar to you. I'm very passionate about this. And it's one of my driving motivations to try to improve care.
Well, thank you for the work you're doing. Now, Dr. Dusatsima, can you tell us your personal story and reason for advocating?
Yeah, absolutely. So my reasons for being in this field are a little bit different and come from a nerdy scientific space generally. So starting in grad school, I was very interested in prescription drugs and how populations use them, and then also started to look at how policies shape whether or not people can access their drugs. So I've come at this first from a scientific point of view, trying to really understand why there are barriers to how people use medicine. But more recently, I have had a personal connection to this. My mother was diagnosed with metastatic breast cancer in 2020.
All right.
And so, it has become personal, but I'd say I have been a passionate advocate for thinking about people's access to medicine broadly, and especially for cancer therapies for over a decade.
It really, I know we've all nodding our heads, especially during the introduction with Dr. Weiss, that yes, we can all relate to this in so many ways, especially once you have that personal story. Dr. Chino, I want to ask, when someone is, as a radiation oncologist, when someone is diagnosed with cancer, their medical crisis we know can quickly turn into the financial crisis too. And but what are the best drugs for many? And often the best drugs are out of reach for many. And why are so many out-of-pocket costs so out of reach and it's so difficult?
So I think probably Dr. Dusatsina is the best person to answer the actual out-of-pocket cost ceiling. I will say that I think there's a lot of really great and important conversations that patients can have with their doctors about their costs. I think, we have already mentioned it 4 times, even on this, the 20 minutes that we've been on this, but for example, how a treatment plan can impact a capacity for someone to continue to work. I think that's so important to know. I think, our drugs are often given in certain different regimens, and specifically for breast cancer, there may actually be some options in terms of, for example, dose dense regimens versus, this kind of standard delivery. There are weekly treatments, even within radiation. As a radiation oncologist, I can tell you that there may be options in terms of how long you can be on treatment, how that treatment is delivered and how precise it is. So all of these things are really important conversations that physicians and patients should be having together. And I always try to stress that we should be always practicing patient-centered care. And that's driven by shared decision-making. It doesn't mean that I, as a physician, say, okay, these are your options. What do you want to do? It's much more of, we talk about what's important to you. I talk about kind of, the level of evidence to support the treatments, and then we make the best plan that's tailored to you, because cancer is not one size fits all. And we need to make sure that our treatments are really optimizing your outcomes for both cancer, your functional status, and then your future, in terms of a cancer-free horizon, minimizing of side effects, or, the balance of what's important to you in terms of what your priorities are for the future.
Well, before I get to Dr. Dusatsima, I want to follow up. You mentioned shared decision-making, which is so important. But a lot of times, and I've gone through this with my sister who's just finished her surgery, getting ready to start radiation. And I hear this from so many patients, including my sister. They don't want to second guess he or she, the doctor, because if you upset them now, they're in charge of your future. This is what I hear. For me, as the reporter in me, I always push back and ask because I wanted to know why. But not everyone is that type of person. And they worry if I push back and say, I can't take this time off of work or this, they feel they may get a second tier type of treatment or less optimal treatment that they need to improve their outcome and to survive.
No,
What
and
do you say
honestly,
to patients that are scared to speak up about this?
yeah, that is a common concern that that we encounter in this field when we start talking about costs, because no one ever wants to think about costs specifically interfering with their capacity for getting the best care. Sadly, we know that if we don't talk about costs, they absolutely can. And there are compromises that patients are having to make for themselves in terms of taking medication, in terms of skipping appointments, in terms of losing their work or their capacity for maintaining their current health insurance. They may even have to change centers because, whatever new health insurance they have is no longer in network for where they've been receiving care. So sadly, I wish I could say that there's no compromises that are ever made related to cost, but I of course know that there are. And again, the concept of shared decision-making is not that I make a decision without you along for the ride. It's the fact that we make decisions together. And if there is an alternative, if it's a conversation between CMF and Dosten's ACT, we should be talking about the trade-offs. We should be talking about the intensity of the treatments, with the side effects that it may cause for you, including, for example, costs and capacity for work, because that is a balance that's really, again, it's that special sauce, that mix that's really, we want to make sure we're honoring and respecting what your priorities are. And that's the whole goal of shared decision making. It's not compromising care without you. It's optimizing the best care. And I think the thing that maybe patients don't understand necessarily is that there usually are options, even if it's the choice between two CKD4/6 inhibitors, there are potentially, there are 4 in the class, potentially moving from one to the other could make a big difference in terms of your copay or your out-of-pocket.
Oh, thank you. Great answer. And Dr. Doucette-Seema, Dr. Chino had just mentioned about the trade-offs. We often talk about there are so many trade-offs in healthcare. We've seen innovative new cancer drugs extending and saving people's lives, but are the best drugs out of reach for many?
Absolutely. And I think that insurance is really key to whether or not you can afford the treatments that your doctor is recommending or that you may want to pursue. So we've done research in this area and found that even among people who are insured by Medicare, that about 30% of people are not filling the cancer drugs that are prescribed to them by their doctors. So we know that costs are an incredible barrier. As Dr. Chino mentioned, there are a lot of things that you can do. And I think opening up the conversation with your care team about the struggles that you're facing it's super important. So this is important because there might be something that they can do to help lower your costs. There are other examples where, some drugs are really, the benefit is a little bit questionable. How much they actually improve your outcomes is not really as well known. And so I think it is worth having a really open dialogue with your care team about how much is this benefiting you relative to its cost.
And I think that question is to say to patients, ask what your risk benefit ratio is. I mean, for me, I went through a different type of journey with breast cancer than my sister, but sitting in that infusion center with her just a few months ago, knowing that the first intensive chemotherapy drug that the patients are getting is like from, I don't know the exact year, but something approved in 1992. And she had to fail first to graduate to a drug that was less toxic and more effective. It's frustrating. And I know I'm preaching to the choir. We just can't start on the more effective drug from the very beginning, but we know that costs more. So we have to start with the drug 1 to graduate to drug 2 if you fail. So the whole fail first is another problem. But I know that doesn't take away from the cost. It's going to cost more no matter what part of the journey you're on.
That's right.
Is there any more you want to add why out-of-pocket costs are so high for patients?
Well, I think we've seen over the last decade or so that the price of the treatments themselves is incredibly high. So if you were looking at the price of new drugs that are coming onto the market in this space for treating cancer, their prices just keep going up and up and up. And there are really no discounts that are provided to health plans for these treatments. They're required to be covered under Medicare, for example, and often private insurers kind of feel the same requirements. So these costs end up being borne by the health insurer that passes them along to everybody else in the forms of higher premiums. So I think that this is a combination of both insurance coverage becoming less generous because of mandatory coverage in some places, but also because the cost of the treatments themselves have gone up quite significantly. Even if you look at some older breast cancer treatments, until they become generic drugs and become widely available, their prices just march up year to year. So even drugs that have starting prices that are quite high, they just keep going up. Even if there's no new innovation or no new expanded indications, it's just the way that the market is set up. There's a lack of competition. And, people are really stuck in this situation of needing to get these drugs to be able to extend or improve their lives. So, part of this is just the system that we have built. We have not created the right incentives for companies to price their drugs in a way that really reflect the value of those drugs to patients and to society. And so we end up in this situation where everything is expensive, and prices just continue to climb.
And not to mention just the prices of drugs. You're talking about childcare, transportation, lost wages.
Yeah, absolutely.
Like it just mounts.
Everything that we need and we don't really have options about purchasing. Yeah, the prices are all going up.
Yes. And Dr. Chino, I want to take it from there and ask you, when we talk about the financial struggles that patients face, you touched on that earlier, but I want to dive a little deeper into the financial struggles and not necessarily adjusting treatment plans to reduce the burden, because I don't want to say that a patient may get less, because no one should get less because of the financial burden. But how can they have that conversation, and what else can they look for? Because it's not just the type of chemotherapy or the pre-authorization for the PET scan or another ultrasound they might need. It's how can we really discuss what I call, when I advocate, we need a pit crew around patients, and we need to be able to support them, the child care, the transportation, the lost wages. How can we help them with, making sure they're not losing their job? We know disability can start months later, even if they get it. So it starts to mount. How do you even have that conversation?
No, I think you raised up some really important points, and it really is this idea that we should be practicing patient-centered care, right? Which is to prioritize our conversations based on what's important to the patient and what's going to effectively treat their disease. And then again, that's both together, right? It's not. I wish I could say I just hold my hand and be like, oh, all I do is treat cancer, so I don't really care about your parking costs. But you know what? The parking costs can be the barrier to you receiving the best treatment, and so it is important. And I think in terms of having these discussions, we really do need to think about, where are you getting your health insurance? Who is living in the home with you, who's available for support, and how important it is for you to be able to continue working. And as a radiation oncologist, I can offer someone potentially 3 different treatment paradigms related to their treatment that may optimize their care related, for example, to their capacity for work. So these conversations are so important.
Can you give me an example of that? So if there's somebody watching right now, like my sister who's getting ready to start her radiation, and they say, listen, missing work is hard, childcare is tough. What are my 3 options? I know we don't have a ton of time, but can you just break down a little bit?
Yeah, absolutely. So radiation is a daily treatment Monday through Friday. And so for people who are still working, that 7:30 in the morning slot or that 6 p.m. slot is really important for them. So again, just working their treatment time around what works best for them in terms of continuing their capacity for work. Another thing is telehealth. So we know that telehealth can really reduce costs for patients. And so every single time I do a new consult for a patient via telehealth, and I see that they are actually at work when I am talking to them, I know that that person did not have to take off work to talk to me for the consult. And again, it's silly, stupid things. I keep someone hostage in my clinic for 4 hours sometimes for, a 40-minute conversation with me. And that doesn't even include their driving trips. So their treatment time, telehealth, and then specifically there are some potential treatment options in terms of how fast we deliver care. And we can talk about the trade-offs in terms of this is the level of knowledge that we have to support this perhaps shorter treatment. And this is my unique concerns for you with delivering it. And this is why I think it may help you. And so those trade-offs are important. So for example, right now we have a clinical trial which delivers all of radiation for someone who's had a mastectomy in 5 treatments instead of 5 weeks of treatments.
Wow.
That's a big difference.
That is huge.
And I don't necessarily recommend that trial to every single person, but I think it has a huge benefit for specific people. So something like, for example, access to a clinical trial that could condense their treatment, that can make a huge difference. And then for some people with very early stage breast cancers, omission of radiation may actually be an acceptable treatment that is evidence-based, that will not compromise their survival from breast cancer. And these are conversations that are really worthwhile having.
So ask your provider, ask your doctor, is there a chance that maybe I can avoid radiation altogether, or can I qualify for a clinical trial that can condense it? So those are great questions. Thank you so much. Dr. Dusit, I want to ask you, what do we need to know about the Inflation Reduction Act that was just signed, and how does it affect the 48 million people with Medicare Part D?
So I think the Inflation Reduction Act is one of the best things that people with cancer and people with high drug costs and in Medicare need, and it's so exciting that it's here. So it is going to help do a couple of things, but the biggest thing it's going to do is it's going to limit out-of-pocket spending under Medicare Part D. So for people filling prescription drugs under the Medicare Part D benefit, they will have to pay no more than $2,000 annually starting in 2025. So it'll take a couple of years before it's in full effect. In 2024, there's a cap on spending, but it's a little bit higher than that. It's about $3,200. But if you looked at what many people with breast cancer have to pay today for taking orally administered therapies, often that can exceed $13,000 or $14,000 on Medicare Part D for the orally administered drugs alone. And so this is a huge financial relief for people that is coming. I think the other thing that, having talked over the years with many people who are being treated for a serious illness, who they're afraid to retire. So maybe they're in a place where their health insurance benefits are actually quite generous, but then they age into Medicare, and Medicare coverage is just so poor relative to many private plans that I've heard people say, I can't retire. I have to keep working so I can keep this coverage. So by 2024 and 2025, you should be able to retire with confidence if you may need orally administered cancer drugs.
Is that because of this Inflation Reduction Act? So it won't take effect until later, 2024, 2025.
That's right. Yep. But relief is coming. And so this is a huge change from the status quo.
Well, that is great news, and we could all use some more hope and great news. Dr. Chino, I want to ask, how does the cost of care deepen disparities in healthcare?
That's a really good question. And I really do think of it, you can think of it as kind of a self-feeding cycle where healthcare disparities perpetuate financial toxicity, and financial toxicity perpetuates healthcare disparities. And sometimes it's actually hard to disentangle them. But we know, as growing evidence would support, that structural racism and the social determinants of health really can change your baseline financial stability. It also can also influence the job you get and whether or not it's hourly, the health insurance that you have access to, and whether or not it's actually affordable, and whether or not it has adequate coverage for something like a cancer diagnosis. And it can even influence your cancer risk factors. So, whether or not you, had access to good, healthy food, what your health literacy is, your access to screening. So we know all of these things are entangled with each other, but even for people, across the board with the same health insurance, comparing, for example, a Black woman with with breast cancer and a white woman with breast cancer, we know that the Black woman with breast cancer is going to face more obstacles to receiving high quality care, is more likely to face financial barriers specifically, and is more likely to lose health insurance after that cancer diagnosis. So we know that there's definitely a lot of work to do. At the point we're at now, we've described a lot of the problem, and we really need to dig in and start fixing the problem.
Well, especially when you think that the health disparities start so much sooner than even diagnosis, that if you can't miss work, you can't get to your screening. And if you don't get to your screening, you're not diagnosed to a much later state, and it snowballs and it affects patient outcomes. And that's what we're hearing. It's this vicious cycle in the underserved population, and it's heartbreaking, but I'm glad we're all doing the work we're doing. Dr. Chino, I want to ask you, there's a question from the audience. It says, on the day of my surgery, the hospital requested payment upfront for hospital surgery costs. Is that the norm?
I love this question because I am going to share for you that I am a physician. I do research in healthcare access and affordability, and the exact same thing happened to me when I had a surgery for my toe. I was in the pre-op screening. I had the bonnet on my head. I was in a gown. They wheel me into the financial services thing, and they do a wallet biopsy. And I thank God I packed my credit card. So it does happen, and it's part of that, paying upfront for your co-insurance, your component of the surgery. And I will say that I talked to 3 different providers, the surgeon, the anesthesia, and a hospitalist before I went in for my before I got the bonnet on. None of them mentioned the cost of the care. It was a complete surprise to me when that happened to me as well. And this idea of price transparency and trying to actually make it so there's less surprise bills for patients,
Right.
but also just so people are prepared. That is something that is an emerging concept that we I think really need to dig into and make it more patient-centered so that patients aren't so surprised by their bills. We know
we have to better empower patients and help them show up better prepared. That's
Yes.
part of my message: prepare, present, prevail. We need to prepare them so they present well and they're positioned to prevail. We only have 1 minute left for each one of you. I want to each end briefly with one thing that people can do today to prepare for the cost, whether they are currently in treatment or not.
I should have. I'll raise my hand. My advice is to know your health insurance. And if you're not in a good health insurance that has good coverage for cancer, to try to change your health insurance to a better plan at the next enrollment period. Because sometimes actually higher premiums are worth it for a better cancer-friendly plan, specifically for people with cancer in their history, to know kind of what their out-of-pocket expenses are for those oral anti-oncolytics or the oral cancer drugs.
Thank you. Dr. Dusatsina?
So I would say ask questions and negotiate. So, I see a lot of people's questions really are about bills that they get from the hospital or medical center. Always ask questions, always ask if there can be a discount if you're struggling to pay. The answer might be no, but it's always worth asking to see if there's something that can be done to help you lower your costs. I will say one other thing I would like to suggest. There is some excellent research on the issue of accommodations and having discussions with your clinical team and your employer about having accommodations as you're getting ready to go into breast cancer treatment. And I'll be happy to send along some information about the researcher leading some of that work. But they've done studies, and it seems very promising that those conversations can help people stay employed. Just having your employer and your doctor on the same page around the need for accommodations as you're undergoing treatment.
Perfect. Well, we would love for you to share that with Breastcancer.org. And I want to thank each of you, Dr. Chino and Dr. Dusatsina. I want to remind everyone as well watching to post your cost of care questions in the Q&A for the doctors to answer. You both did an excellent job. Let's remember Breastcancer.org, the special report. If you haven't had a chance to read it, it is phenomenal and impactful and has so much great information. It includes stories and perspectives of women who have dealt with the financial troubles related to their breast cancer diagnosis. They shared how these challenges have impacted their own lives and what they've learned that could help others, which could be you in similar circumstances. So we want to go ahead and take a look. Several of these women talked to the video for us, so let's go ahead and take a look.
Really processing and registering that big C word, you have cancer, is like, it It sent me into shock.
All the complications associated with breast cancer can be gut-wrenching and even heart-wrenching at times.
I was definitely concerned about how my life would change and turn around.
It was very, very hard to wrap my head around the idea of my life being shortened.
And that's kind of when panic set in, because I was like, oh my God, I have 5 kids who are dependent on me. Where do we go from here? My original diagnosis was in November. It was invasive ductal carcinoma, stage 3, triple positive.
I was diagnosed with triple negative breast cancer in May of 2021.
I was diagnosed with breast cancer in 2015, and 1 year ago, I was given the news that the cancer was back, and I am now diagnosed with stage 4 metastatic breast cancer.
I was first diagnosed with breast cancer back in 1996, and then I had my second diagnosis of breast cancer last year.
Getting diagnosed with breast cancer financially impacted me way more than I thought it would. The cost of things like childcare, because I'm in the hospital and I have to make sure that their needs are being met.
It was going to be a 9-month journey to challenge this cancer, and I was extremely concerned that I was going to lose my job.
If I can't work because I'm sick, because I'm throwing up, or because I'm physically unable to, how are we going to pay the bills?
My work tried to work with me and was giving me the time, but I went from 40 hours a week to barely making 10 due to fatigue and symptoms and other issues.
I was really financially strapped. I couldn't work much. I was taking days off of work and not getting paid for it. So it really had a big impact on my life.
I am still dealing with lots of doctor's appointments and missed time at work, and missed time is more missed wages. For many of us, the financial ramifications of this will continue to echo on throughout our lives and not just end when treatment ends.
My advice to others who have been diagnosed with breast cancer is to be your own advocate. Go online, see what your resources are before you get too sick to really feel up to doing it. And if you can't do it, then you need somebody that will do it on your behalf.
There were a couple of resources that helped ease the financial burden. The social worker with my hospital and my team set up different kinds of grants, and I was able to set up a GoFundMe with my daughter's friend setting that up for me. It feels like an invasion of my privacy, but it also is humbling and so overwhelmingly amazing that people that I barely have a relationship with have jumped in to help me or my family.
Throughout my treatments, I had a lot of people that were there to support me in my life, but I think the thing that helped me the most was having somebody come and sit down with me every couple of weeks and go through the bills.
Even the smaller nonprofits that are local, they do some really great things like free rides to your treatment. They'll do grocery runs for you. There's help out there for those of us who are struggling.
You just need to be able to ask, as hard as it may be.
I hope that this is just a chapter in my very huge book of life. I just want to pay it forward for all the help that I've received.
Powerful, powerful video. I want to thank everyone, Amy, Heather, Vanessa, Nicole, for sharing their personal stories with us. As we all know, it's not easy to share your personal stories of this journey. It's now my pleasure to welcome 3 incredible patient advocates that I am just so honored to share the stage with. Our next leaders on the panel, Molly McDonald from the Pink Fund, another warrior sister, Joanna Morales from Triage Cancer, and Amy Niles from the PAN Foundation, all doing incredible work. An honor to be here with each one of you today. So thank you so much for joining us. Before we dive in, I want to give each of you time to give a quick summary of the work that your organization is doing and how you're helping people, particularly as it relates to the cost of cancer.
Well, I'm happy to start. First, it's truly an honor to be with all of you today. The Patient Access Network Foundation, or we're commonly referred to as the PAN Foundation, is a national patient advocacy organization that at its core is providing a safety net for people who need financial assistance for their out-of-pocket costs for their prescription medications. We've been here since 2004. Since that time, we've helped more than 1 million people afford their medications. We've provided more than $4 billion. It's a big number, $4 billion in financial assistance. We provide this assistance to people who are underinsured, many of whom are Medicare beneficiaries. And the reason we focus on Medicare beneficiaries is that people on Medicare can't find financial assistance directly from pharmaceutical manufacturers. So charitable foundations like PAN really provides a really important safety net. Today, we operate around 70 different programs that provide assistance for people living with serious illnesses like cancer, other chronic diseases, rare diseases. One of the programs we operate is for people living with metastatic breast cancer. And so if one is eligible, and it's for Medicare beneficiaries only, and if we have the funds, which is always an issue for some charitable foundations to give out to provide a grant, we can offer assistance of about $5,500 over a 12-month period. In addition to providing what we think is this life-changing assistance truly is, we also advocate for lowering out-of-pocket costs. So some of the reforms that Stacy just spoke about, such as the Medicare Part D cap, something that we've been advocating for a really, really long time. She mentioned, I think, a statistic about a third of individuals can't start treatment because of costs, and that's correct. In fact, Kaiser Family Foundation did a survey earlier this year that said 1 out of 3 people walk away from the pharmacy counter because they can't afford their costs. In fact, it doesn't take much to walk away from the pharmacy counter. People faced with $125 will walk away from the pharmacy counter. So imagine living with a serious illness like cancer and faced with hundreds and if not thousands of dollars in out-of-pocket costs. So we're humbled to do this work and wish we could help many, many, many more people.
Yes, and we're grateful for the work you're doing. There are so many people in need of help. Joanna Morales with Triage Cancer, I want to send it over to you for you to share why you're involved and the work that your organization is doing.
Thanks, Loriana. Triage Cancer was actually formed to help people navigate the legal and practical issues that come up after a cancer diagnosis that all actually impact someone's financial situation. And there are things that you don't think of as legal issues, like how to get health insurance coverage and how to pick the right plan for you and how to take time off work or access government benefits or financial assistance programs. So at Triage Cancer, we provide free education to help people understand what's available to them and make educated decisions so that they can pick the best path forward. And we do that through providing free educational events, both in person and online. We have a plethora of educational materials and resources in lots of different formats. And then we also offer a free legal and financial navigation program, which helps people one-on-one navigate any of the issues that they might be experiencing or questions that they might have.
Well, I could say even after the advocacy that I do, when my sister was diagnosed, you're the first person I called crying, wondering how is she going to pay her bills. And so again, I'm thankful for your friendship, the advocacy you do, and thank you so much. Now I want to send it over to Molly McDonald from the Pink Fund to share why you're involved with the work you're doing.
I was diagnosed at a time of job transition, and I'd been through a financially devastating divorce with 5 children. I had no savings, like about 62% of Americans have no savings. I had no alimony and no child support. So that diagnosis really kind of derailed my job opportunity, leaving me unemployed and unemployable with a COBRA premium of $1,300 a month. And at that time, I was ineligible for Medicaid because it was predicated on my previous year's income, which knocked me out. So within 3 months, my home was in foreclosure. I had to make choices between taking part-time work and paying my COBRA premium so I could get care or paying my mortgage. So my house is in foreclosure. My automotive creditor was calling me every 58 days, asking if I was planning to make a payment or should they plan to repo my car. And by the end of my treatment, my utilities were threatened with shut off, and I was in line at a food bank to feed my family. But my sort of Oprah aha moment came when I met all these other working women in treatment. So, you're in the waiting rooms and you start chatting, and I heard them talking about, they had much more aggressive disease. They were in long-term toxic treatment protocols, and they were concerned that their treatment was going to outlast their FMLA benefit and they would lose their job. So they were discussing stopping and going back to work. That was it. They were going to stop treatment and go back to work, or they're going to put their house on the market, or pull their kid home from college, or liquidate whatever IRAs they had. And so I went home to my new self-employed husband and I said, I think we need to start this organization and pay these women's bills directly to their creditors for 90 days so that we can provide a financial bridge, at least some breathing room for the patient and the family. And he looked at me like I had two heads and he said, yeah, right, because we just rescued our own house from foreclosure. But I always say because he sleeps with the boss, he went along with it. So we bootstrapped the whole thing. I traded my kitchen table for our Heart and Ribbon logo, got a donated website, and then the medical reporter at the Detroit Free Press, where I'd once been an executive, wrote a front page story and 27 newspapers picked it up. So we do one simple thing. Patients who apply for help from us are in active treatment for the disease, which means mastectomy, chemo, radiation. It does not include the long-term hormonal therapies. The family household income must be at or below 500% of the federal poverty level, which often allows us to move people over to like PAN Foundation, who has some of these same guidelines on household income. And then the household at this point has to experience some loss of income. So either the patient or their partner or spouse has lost income. They apply to us. We have supporting documentation. So we verify their household income with a tax return. And then their file goes to a committee of volunteers every single month. And we're now writing checks around $100,000 a month for those non-medical essential bills that really impact treatment adherence.
And that leads me to my first question. So I'm going to, and since you're my first question, while you're unpacking this, what are some of the most common financial needs that people should anticipate during cancer treatment? There are so many, but the ones that you're hearing from those patients, I know I can give you a long list, but I want to hear from you.
Well, I think nobody expects to get a cancer diagnosis, right? So as I said earlier, they often select a premium, health insurance premium based on the cost of that, and not anticipating that they're going to have a $10,000 deductible. So that's always, I mean, it's just a huge surprise. Copays are a surprise. But I think what really derails things financially for families is when they can't work. So when that lost income collides with the deductibles and copays, that's when they're standing on the edge of this financial cliff about to go over and making life-altering decisions, not only financially life-altering, but really life-altering. I mean, you know, if you don't adhere to your treatment protocol, you're going to be facing the potential for earlier mortality. And that's the most egregious piece to me. The other major concern that I have in this space is that when patients can't pay their bills and their bills are late, this affects their credit report. And that Joanna would know for sure how that can follow them. So if you lose your job and you can't pay your bills and you go into medically related bankruptcy and then you try to go get another job or you need to buy a car, like in my case, I had to return in my car and I had to go buy another car and I had to pay 29% interest. So it was just impossible. I was making a huge car payment of $700 a month and $2,005 for a old kind of beat up, I don't want to say the name of the car, but it wasn't, you know, I mean, got me where I needed to go, but that interest rate was high and it really troubled me for a long time. I think it took me about another 10 years to build my credit report back up.
It takes a long time. And I do want to get to the other panelists, but what I want to add in is what's, from my perspective too, what is so hard, if you're not in the underserved population or you don't meet that criteria, you will. I felt like I was a well-established news anchor and we headed in that direction and we almost lost our house. My sister is on the cusp of meeting that criteria. And so her problem is, how do I qualify when I'm on the cusp and I don't qualify yet, but I'm headed there. So hopefully we can continue to expand the help and the resources for patients that we can help even more people financially as they go through cancer treatment, because it's no matter where you start, you're going to find the financial toxicity will take a toll.
Yeah, and I think patients need to be reviewed for that from the time of diagnosis and as they go through treatment. Somebody needs to be checking in because you don't anticipate that you're really going to have a problem. So in some provider settings, there are software programs like TaylorMed that will help patients and navigators determine what your insurance costs will cover, what your ancillary costs might be, like $20 a day for parking at a major cancer
Right.
center undergoing radiation, and then help direct you to charitable programs. And the reality is, patients are having to cobble together multiple streams of support in addition to what we provide.
Yes.
There are many organizations that provide, bits and pieces, and that's the challenge. Is it kind of becomes a business.
And I want to send it over to Joanna for a minute. We're talking about job loss. Patients, like my sister, when I reached out to you, are terrified of losing their jobs, especially if they have insurance through their employer. Can you talk more about the patient's rights for taking leave and keeping your job, whether you're salaried or hourly?
Those are questions we get absolutely every single day from people who are worried about work. And I think that I said this at a conference the other day, even if we made cancer treatment free, there'd still be a financial burden if patients needed to take time off work because they're not having that income come in, and that's potentially connected to their insurance coverage. And so when people are thinking about their employment rights, they often just jump to the Family and Medical Leave Act or the FMLA because that's what most people are familiar with. But it's really important that people understand all of their employment rights, because the FMLA does allow employees with cancer to take time off work and have access to job protected and health insurance protected leave. That's not the only law. And if it doesn't cover you, like if you don't work for a large enough employer, or you haven't worked there long enough or enough hours, you don't qualify for those protections. And so understanding what other options like state or even county or city laws might apply to you, and then also understanding how the Americans with Disabilities Act and state fair employment laws can actually help you take time off work under a reasonable accommodation, which Stacey mentioned earlier. So it's really, we talk about it as a puzzle, and all the puzzle pieces that someone might have access to. Everybody's puzzle is going to look different. But if you don't understand all the puzzle pieces, you're missing out on potential options and protections to either stay at work, return to work, or take time off work.
So if your employer doesn't have FMLA for you and you're in an hourly job, let's say at Target, Walmart, one of these employers, or even not as well established employer, what do you do?
There are laws that apply to smaller employers. Many state laws actually cover small businesses. And that's where it's important to not just know like the FMLA, for example, but to understand that you can take time off work as an accommodation under your state fair employment law. And there are about 20 states across the country where the state fair employment law applies to employers with one or more employees. So that means all the employers in that state. And so understanding your options is something that we can help you do at Triage Cancer so that you're not missing out on the protections that are available to you.
I have so many more questions to follow up on, but we have limited time. Amy, I want to ask you, when someone is choosing an insurance plan, what should they look for that will give them the best coverage for cancer care and medications?
That's an important question, and there's a lot to that. So I think to begin, one needs to understand the costs relating to that plan. What are the deductibles? And we all know that so many plans have these high deductibles that really impede access to care. What are the co-insurance obligations? What's the out-of-pocket maximum? I think one really needs to dive into the cancer treatment costs that the plan's covering. Is it covering the medical office visits? Is it covering surgery, blood test, chemotherapy, radiation therapy? Is the healthcare provider that you're seeing or your cancer center in network? How does the plan address, out of network? If you need hospital stays, overnight hospital stays because of your chemotherapy, will the plan cover that as well? What about second and third medical opinions? Will it cover those opinions? And of course, one needs to look at prescription medications. Are the medications that you need covered in the plan's formulary? What tier is it on? What does it mean in terms of the out-of-pocket costs you will incur? For people that have commercial insurance, they may be able to seek assistance directly from the pharmaceutical manufacturer for that medication. So for example, the program may be able to give a coupon to cover the cost of that medication.
And I
One-
want to pause on that and then have you finish.
Yeah.
For any patient who's watching right now, because when we're talking about formulary and different tiers, if you're not as health literate, that's a lot to really wrap your head around and understand. So talking directly to the patient, how would you break that down? If someone's struggling right now to pay for their copays, and we're coming up in November, they're looking at their health insurance plan, how do they know how to find the coupon? Can you break it down a little bit more for us?
Yeah, well, the coupon can be found in one of two ways: by directly going to the drug manufacturer. So you obviously need to know the medication that you're taking and who manufactures it. But a lot of people don't have that information. So a good resource is an organization called NeedyMeds, which is needymeds.org, and they have a pretty comprehensive database of all kinds of patient assistance programs. I encourage people to really look into those programs and see if the coupons are available to them. Just one word of caution on the coupons, though, is that there is a unfortunate growing trend amongst insurance plans to have, in very small print, what's called copay accumulator policies that is very difficult to understand, but
Yes.
the bottom line is that the value of those coupons may not be counted toward one's deductible or out-of-pocket maximum. So what we're finding is so many people are getting to the pharmacy counter, they think that their costs are covered, and they're told, no, your plan is not going to accept this, and now you have to pay hundreds, perhaps thousands of dollars right then and there to walk away with that prescription
So
filled.
to understand that, if you've gotten so many coupons towards your deductible, like $500 towards $1,000,
I would get
they
on
don't count it.
They may not count it. They may not count it, which is truly unfortunate. There are 15 states now across the country that have banned these policies, and there's federal legislation that we're all pushing for because we truly think this policy is not good patient care, and it's discriminatory as well. So we're advocating to abolish those policies. If someone is on Medicare, of course, you have to understand your benefit. And Stacy talked about the provisions that will start taking effect in 2024, which will lower costs. But for next year, these costs may remain high for many because you'll have the deductible, you'll have your share of the drug costs to pay, and then you're into that what's called the catastrophic phase of your benefit when you have to pay 5% of your drug costs. And I always say 5% sounds like a low number. 5% of a really expensive medication can be a very big number. So again, we're looking forward to 2024 when some of these costs may come down for patients.
So we're getting help, not soon enough, but the hope is on the horizon.
Yeah.
Joanne, I want to go back to you, and then Molly, I promise I'll get to you. Even if someone has insurance that is a good fit for their situation, patients we know still need to learn the ins and outs of their policies to minimize costs. And again, this is health literacy comes into play. It's hard when you're well educated to understand your policy. What is the most important to know?
The first is to actually know the terms of your health insurance policy. So you were talking about formularies and tiers, and insurance is an entirely different language. We get accused a lot as lawyers of speaking in legalese. Well, insurance has its own language entirely. And we do a lot around health insurance literacy because only 4% of Americans actually know the 4 key terms that are used in buying a health insurance plan. And so that means 96% of us don't know those terms. So that's why we think it's so important to provide education. But there are also things like using in-network providers. So only going to the providers that your insurance company contracts with will lower your out-of-pocket costs. Making sure that if you're getting care or prescription drug, asking your insurance company, do I need to get your approval ahead of time? Those are called prior authorizations. And they don't tell you ahead of time what you need a prior authorization for. So it's always a good idea to ask, because if you don't get that prior authorization, they may just deny coverage entirely, and you're paying for all of that care out of pocket. And then it's pretty common for insurance companies to deny care. So if you get a denial for something, it's really important not to take no for an answer and to actually appeal that denial. And I know that sounds so much easier said than done, but at Triage Cancer, we have a lot of really practical tools to help you do that. but no one does. And when I say no one, I mean 99.9% of claims that are denied don't get appealed, even to the first level of appeal. And so that means patients are either not getting the care that they were prescribed by their healthcare team, or they're paying for it out of pocket when they don't necessarily need to. Because if someone goes through the appeals process, 50% of the time they're successful. So that's a whole lot of people who are paying out of pocket for care that they don't need to, where their insurance company should have paid.
Yes, you have to advocate for yourself and push and never take no for an answer. Molly, I'm going to start with you because I have to wrap it up and have everyone have their last word. We're going to close with one question. What's the one thing you want everyone to leave here knowing about managing the cost of care?
Ask for a financial navigator at the hospital where you're receiving treatment.
Yes, ask for a financial navigator and keep pushing for answers. I want to send it over to Amy and Joanna. Amy, do you want to give?
I would say you have to advocate for yourself. So for example, if you've been prescribed an expensive medication, you should feel comfortable saying, this medication is really expensive. Is there another that's equally effective that may cost less? And then I fully agree with Molly. I think financial counselors, patient navigators are tremendous resources for patients.
Absolutely. They're doing great work. We need more of them, but they're doing great work. Joanna, one last word from you.
I would definitely echo all of that, but lots of places don't have financial navigators. So knowing where to go for help for all of these things and more is critical. But know that help is out there. And the most important thing that you can do is ask for that help, and you can get referrals to those resources.
Wave the flag and ask for help. It's okay. I always say you never know when my story will be your story. So it's good that we can all help one another. Amy, Joanna, Molly, you're all doing incredible work. Honored to be here on the stage with all of you. Thank you so much for your insight. You're making a huge difference. And now we have a special message from Eric Anderson, Division President of Breast and Skeletal Health Solutions at Hologic.
Hello, my name is Eric Anderson, President, Breast and Skeletal Health Solutions at Hologic. At Hologic, we strive to help people live their healthiest lives with leading-edge technologies that support patients through the entirety of their breast cancer journey. This starts with life-saving 3D mammography screening and continues through diagnosis to treatment. But the reality is that our technologies are only effective if patients have access to them. Unfortunately, breast cancer can place an extraordinary financial burden on patients and their families, potentially forcing impossible decisions. For some, this means avoiding screening entirely, which could result in later diagnosis when breast cancers can be harder and more expensive to treat. Others may be forced to skip treatments or forego options like reconstructive lumpectomy, which can contribute to better long-term quality of life. At Hologic, we believe cost should never be a barrier to receiving quality care. Everyone deserves access to the best breast cancer technology and treatment. It's why we're investing in programs like Project Health Equality, which aims to increase access to screening and treatment by overcoming barriers to care, particularly those impacting Black and Hispanic women. And it's why we're proud to partner with Breastcancer.org to present today's program. We hope you leave today with the valuable resources and the information needed to advocate for yourself or your loved ones. Thank you.
Thank you so much, Eric. And thank you again to our panelists and the women who graciously shared their personal stories about the financial burdens of breast cancer. We'll email everyone with a link to this recording and a link to the special report. Before we go, I want to remind everyone that you can find support and connect with others who know exactly what you're going through in the Breastcancer.org online community and by participating in our virtual meetups. Thank you all for joining us, and take care.